Well, Health Workers Union Hospersa has slammed the Free State Health Department for terminating contracts of close to 100 community workers. The Provincial Health Department says it took the decision because the workers have criminal records. But the union says the records are for minor offences related to community unrest and protest. Well, Hospersa's Kevin Halama joining us to talk about this morning. Kevin, a very good morning to you. So the reasons given by the Department of Health are reasons that you don't accept at the moment, although you say that these were light offences emanating from unrest and protest. Was the department aware of this in the first place when these people were hired?
Good morning, Iveka. Yes, we're totally against this decision. We think this decision is unlawful. It warrants to unfair labour practice. In 2018, Iveka, when community healthcare workers were moved onto the PESAL system, as per the resolution that we signed at council with the employer, these community healthcare workers were moved from NGOs. They were employed from NGOs and they were moved on the PESAL system. And further to that, what has transpired is that now we are moving closer to getting these community healthcare workers to be permanently employed within the Department of Health. Now, the department was fully aware from 2018, when they gave these employees their contracts. In 2018, the contracts were renewed again in 2019. And now, all of a sudden, only the Department of Health in Free State is saying that they're not going to renew these contracts, whereas the other provinces, they are not even considering the issue of these minor offences that these community health workers are affecting on their criminal records. I mean, some of these offences, they amount to things like petty crimes, from shoplifting, from service delivery protests, which took place as far back as in 2015. We think it's absurd that the department is actually not renewing these contracts of these employees.
So, if they were aware of these records, Kevin, have you questioned them as to why now? Have you questioned them? What's been the reason?
Well, that's it, Iveka. We've lodged a dispute at the PHCD, at the Public Health and Social Development Council, disputing the dismissals of these employees, because we totally do not understand why all of a sudden now these employees are being told that they don't have any employment anymore. And by the way, Iveka, like I said, a lot of these employees, they are coming from NGOs. Now, if you are saying that you are no longer employing them within the Department of Health, they also no longer have a job waiting for them within these NGOs. So you're basically saying that they must go and join the unemployment queue. And that is totally unfair, Veka.
What kinds of jobs were these community workers actually doing, Kevin?
Prior to COVID-19, community healthcare workers, their main job is mainly to go out into the field and ensure that they deliver medication to people that are HIV positive. They track and trace HIV positive defaulters. Also now, with the COVID-19, they've played such a critical part within the Free State in ensuring that the Free State is able to track and trace COVID-19 patients. For now, for them to come back and say that these employees, that they're no longer fit to work in this department, it's a bit of a slap in the face, because now they've done such extremely good work throughout the lockdown period with tracking and tracing of COVID-19 patients. So we're totally against this decision, and we are challenging it, and we won't back down from challenging this decision.
So, Kevin, to your knowledge, and I'm just playing devil's advocate here, if the Department of Health were to be concerned that maybe any one of their histories or whatever it is that they were charged for in the past might impact their job at the moment, to your knowledge, no one has done anything wrong in the time that they've been working for the department or performing these duties?
To our knowledge, Iveka, we've looked at quite a few of the cases that have been brought forward by a number of these community healthcare workers. Like I said, a lot of them, it's offences that they've done as far back as in 2015. It's not offences, not recent offences, and even those offences that are like your protest delivery, service delivery protests. So we don't understand where the department is going with this. And shockingly, Iveka, we've also found out that a number of these vacancies that have now been left open, the department has gone ahead and is starting to advertise, whereas we've issued a dispute on the dismissals of these employees. So now we totally don't understand what the department is doing by taking these employees and basically saying that they must just go and be unemployed. It's totally a very heartless decision that we feel the Department of Health is taking in the Free State.
So, Kevin, you as Hospersa, what do you believe is really going on then? What do you think has really motivated their actions?
To be honest, right now, to speculate, it's something we wouldn't want to do. But now, when it raises eyebrows, Uveka, when now you have a Department of Health that acts against, it's not acting in consistency with the other provinces. In other provinces, the community healthcare workers, their criminal records are not being taken into consideration. But in this one province, we are seeing this happen. Now, if we were to speculate, we'd definitely suspect there's foul play happening here. And by the nature of the job, and when you advertise that vacancy, quite a number of people would be able to apply for it. So now we will definitely look into it and see if there is any foul play that the department is playing.
All right, well, we look forward to your feedback after that, and we'll follow the story. Thanks very much, Kevin Halama from Hospersa. They're still on.